In about 2000, we moved into our current building. Has anybody ever seen the clinic? Has anybody ever been on? It's beautiful. It's in a beautiful setting, isn't it? We're actually in a converted dormitory that used to be the dorm for Miss Ruby's kids when they had a residential summer camp. So it's not big and it's not glamorous by any means. It's in a beautiful setting, but I always tease that all those years at GlaxoSmithKline, I wanted that corner office, you know, with its own bathroom and all that. And now the office does have its own bathroom, but the toilet's about this tall. And we also use it for our conference room and our storage room and everything else. So space is always an interesting thing in our clinic. Our clinic provides care. We see about 2,100 patients a year, 2,000 patients. So that's 17,000. And they come to, we see about 6,500 visits. So about 6,500 times people come to our clinic. I like to think of that as 6,000 visits that were avoided at the emergency room, because for the patients that we see, their only other alternative is to go to the emergency room. A visit to our clinic costs about $60, not to the patient, but costs us about $60. A visit to the emergency room costs about $1,600.
Yeah.
So Bruce Bailey, who is the CEO of the hospital, sits on my board of directors, and he's very interested in what happens at Smith Clinic. And the hospital, Georgetown, we're so fortunate to have Georgetown Hospital System in this area. They are very good to the clinic. They provide any tests, any labs that our patients need, they're provided for free. So our doctors can order an MRI, the patient can, if they need it, and the patient can go and get that for free of charge. Most people, when I talk to them, there's a couple of things that are misconceptions about the clinic. Well, first of all, most people have never heard of the clinic. Anybody in here never heard of the clinic before? There's always somebody. Oh, okay, well that's good. Another one is kind of that, it's kind of a aspirin and Band-Aid clinic, and unfortunately nothing could be further from the truth. Our top 3 diagnoses, just like the general population, are high blood pressure, diabetes, high cholesterol, and running neck and neck with high cholesterol is depression. Not unusual if you think about the population that we serve. But those are all chronic diseases which require medications and ongoing management. So that's why we're seeing patients, over and over again. Diabetes is our number 2 diagnosis. I hate diabetes. I hate diabetes. Diabetes is an epidemic in this area, an epidemic in our country. It's actually been traced back that there's a genetic predisposition to diabetes in this area. So every 3rd person who comes through the door of our clinic is going to have diabetes. And so for those people, we are looking at, and it's not unusual for people to walk through the doors and be like, nobody wants to come to a free clinic usually, very few people. So they come in because something hurts. They've got a sinus infection, an ear infection, they hurt their toe, something hurts. And that's what they tell the docs they're there for. And then as the docs are talking to them, they find out, well, I used to have diabetes, I used to have high blood pressure, I used to have all these things, I don't have any symptoms, so I must be okay. Well, all those are asymptomatic diseases, but they do require treatment. So they come in for something and they will walk out with medications for something else. Because of those chronic diseases, and all those diseases require usually multiple medications these days, our average patient is on about 6 medications. So we work really hard to get our patients. We either prescribe generic drugs, which I came from a branded pharmaceutical company, but I see the other side now. We prescribe generics when available, but our patients who are on 6 medicines, even if they're only $4 a piece, that's like $24 a month at least, that they probably can't afford. So we enroll our patients in patient assistance programs, and we have great success with that. So because of our relationship with the hospital and our volunteers, we have over 134 volunteers at our clinic. We are very fortunate to have about 24 providers that volunteer there. We have retired physicians, nurse practitioners. Our clinical director is a physician's assistant, and we have a number of retired physicians who have their volunteer licenses in South Carolina. We're very fortunate to have all these doctors. We also have some currently practicing doctors in the community who come in to see patients in our clinic, and that's also volunteers, our relationship with the hospital. We can provide care for a patient for $250 a year, full medical care for $250.